Hello, I'm Dr. Mukul, HOD of Neuro Rehab in NeuraXis Care and Research Center team. Today we talk about the spinal cord injury and its treatment. First we talk about the spinal cord. Spinal cord is connected to the brain to the lower back of the spine. It carries the nerve signal from the brain to throughout the body. These signals help to feel the sensation and move the body part. Any damage to the spinal cord, they affect the movement or its function. Spinal cord injury can happen two types: traumatic and non-traumatic. Traumatic is a sudden traumatic blow to spine that may be fracture, dislocate and compress one and more vertebrae that may be damage to the spinal cord. Most commonly is a motor vehicle accident and fall from the height, gunshot injury, knife wound and impact sport like diving in the shallow water. And non-traumatic is disease like cancer, osteoporosis. Osteoporosis is a weakening of the bone and infection like transomolitis and this problem. Spinal cord injury can be divided into two types: incomplete or complete. Incomplete injury, there is no sensory and motor function below the level of injury. In incomplete injury, there is a many treatment all over the world there. And complete spinal cord injury, there is no motor function and sensory below the level of injury. There may be quadriplegia, there is all four limbs get paralyzed, and paraplegia, both lower limb get paralyzed, depend upon the injury of the spinal cord injury. The complete spinal cord injury, there is only specific treatment is in the world. There is a epidural stimulation. Epidural stimulation is the most advanced invasive treatment option for the spinal cord injury patient. Epidural stimulation is a surgical procedure where we put the chip or electrode on the spinal cord. This chip connects to the battery where we put on the buttock region. In this epidural stimulation, we can stimulate the electrode which is placed in the specific area of the spine that may be help to move the patient limb. And after the epidural stimulation, next day patient able to move his limb voluntary. And after 4-5 days, patient able to walk on platform walker. In epidural stimulation, patient come for 45 days for the neuro rehab treatment. In this neuro rehab treatment, patient focus on normal ADL activity, how to stand from the wheelchair from walker, and gait training exercise. In this gait training exercise, patient teach to how to walk on the walker on first initial days, and also focus on the trunk strengthening exercise to improve the mobility of his spine and stability of his spine. Also teach the patient the home exercise program to when patient go back home, he will continue this exercise and walking home also. And any further inquiry regarding this, you can contact on NeuraXis Care and Research Center website. Thank you.